L-arginine. We have already discussed in the last video what is L-arginine, how it is useful and in medical field, and whether it is useful or not in athletics, bodybuilding and muscle performance, endurance and muscle building. Today we are going to talk about how safe is if you're using L-arginine and what special precautions and warnings are there regarding the use of L-arginine in cases of diseases, if you have some allergies, if you have blood pressure, thyroid problem, kidney problems, heart problems, etc, etc, etc. Yes, are there any interactions with medicines, with some other supplements, with some other things? Yes, there are so many interactions of L-arginine which you need to know about. So that's why this video is very important. Let's talk about it. Arginine is actually converted into nitric oxide, which causes blood vessels to open wider, improve blood flow, and that's why it is used by many athletes. And it is also supposed to stimulate some secretion of growth hormone, insulin and other substances in the body. But due to its inability to increase nitric oxide production and enhance muscle blood flow or improve the exercise endurance or performance through oral supplementation when compared to actual exercise, it's negligible. That's why it is not recommended in healthy athletes, but it is useful in diabetics and people who have cardiovascular problems and some other people, some other diseases. We have already discussed these in the past in the last video. But is it safe? We've already seen that taking more than 10 to 13 grams per day of arginine can cause side effects of abdominal bloating, gout, they can cause diarrhea, nausea, right, abdominal pain, allergies, sometimes worsening of asthma, allergic airway inflammation and even low blood pressure, right? But most important precautions which you need and most important warning which I need to give you is in some cases like pregnancy and breastfeeding. L-arginine is safe during pregnancy for a short term, but for a long term during pregnancy, we don't know its side effect. That's why you do not have to take it on your own. If your doctor suggests using L-arginine during pregnancy for a short period of time, if you're having high blood pressure, then you can take it. In children, again, there is a problem that we don't know what side effects can happen. That's why L-arginine, if you do not need it, then you should not take it if you are a child. L-arginine in asthma and allergies can actually cause more problems to emerge. It can cause swelling in the airways. It can actually cause allergic responses. So you should not take if you have allergies, if you have any asthma, or you should be very cautious. Same goes with people who have cirrhosis, liver problems. If you have fatty liver grade 3 or something like that, L-arginine should be used with caution in people with cirrhosis. Then there is enzyme, some kind of enzymes deficiencies like metabolic enzymes like guanidino acetate methyl transferase deficiency. These people also can have complications when they take arginine. So this is a rare disease. Herpes, but herpes is a common problem, and if you are taking L-arginine, herpes can become worse, and there is an evidence that L-arginine is needed for herpes virus to multiply. So if you have herpes viral infection, L-arginine is very bad. If you have low blood pressure, L-arginine is bad because it might lower your blood pressure and it can be a problem. If you have that, you can have dizziness, you can have syncope. If you have a recent heart attack, L-arginine might increase your risk of death, right, especially in older people. So you should not take L-arginine if that is so. If you have angina problem, then that can be beneficial as discussed in the last video. Kidney disease, L-arginine can cause high potassium levels in the body if you already have a kidney disease, and in this case it can cause heart rhythm problems. Arrhythmias can be potentially life-threatening. So kidney patients, don't think about taking them. Surgeries, again, if you are going through a surgery, L-arginine can help in recovery, but it can affect your blood pressure. Now that is a concern. So during and after surgery, you should always consult your doctor whether your blood pressure is on the lower side. In that case, there will be a problem. If it is on the higher side, then it's okay, but be safe. Stop taking L-arginine at least 2 weeks prior to a scheduled surgery. Then interactions. Yes, there are so many interactions of L-arginine with medicine, especially high blood pressure medications. Any antihypertensive drug, L-arginine seems to decrease blood pressure, so that can cause a problem. You can have a significantly low blood pressure, including medications like captopril, enalapril, losartan, valsartan, amlodipine, etc., etc. Even diuretics can have associated low blood pressure. So be cautious about this kind of a combinations of medicines. Then diabetics. L-arginine seems to decrease blood sugar as well in people with type 2 diabetes. So diabetic medicines are also, if combined with this L-arginine, you need to check your blood pressure, because that can cause your blood sugar to go down very low, causing dizziness. So you need to closely monitor your blood sugar as well. Then some other medicines like L-arginine for one is high blood pressure, high blood sugar. Then talking about ARBs or any kind of medicines for increasing blood flow, right? It decreases blood pressure. So isoprenaline, then any other medications like nitroglycerins, isosorbitate, which actually also increases the blood vessels diameter, should not be taken with L-arginine, or else you can have problems. Medications which slow blood clotting, anticoagulant, antiplatelet, arginine seems to slow blood clotting as well. That's why taking them with these medication can increase your chances of bleeding, bruising, right? So antiplatelets should not be taken with arginine. Then medication which slow the blood clotting, for example, these are aspirin, clopidogrel, injections, dalteparin, heparin, etc., etc. Then some other medications like sildenafil, right, Viagra, should not be taken with L-arginine, because it can reduce your blood pressure. So you have to keep in mind that factor before using them together. That is a side effect. Water pills, diuretics also reduce blood pressure. L-arginine also reduces blood pressure, so that can be a side effect. Then herbs, many herbs actually reduce blood pressure, and like ashwagandha and other medications. So using them together, like casein peptides, cat's claw, and coenzyme Q, fish oils, all these things can actually reduce blood pressure. So, and even blood sugar, some of them, so you have to understand the side effects if you have a low blood sugar, low blood pressure. So be cautious on this aspect. It is good for people who already have a high blood pressure, uncontrolled blood pressure, or maybe diabetics who don't have control, but still you have to keep this in mind. Then the arginine actually causes your pancreas to increase glucagon production. Glucagon comes to the rescue when your blood sugar levels are too low. So glucagon makes your liver convert stored glucose sugars, right, like glycogen, into sugar, into blood sugar, and release into the blood. So using L-arginine with xylitol and other kind of products can keep L-arginine from stimulating this pancreas to release glucagon. So remember that. Then in food, L-arginine does not actually interact with any kind of food except garlic or any clove and other these kind of herbs, which you can say, which actually slow blood clotting. Yes, garlic and clove do that. So remember these factors, and they can be used with caution. Arginine needs supervision, so it can be used in erectile dysfunction, in even chest pain, blood pressure, diabetic patients, heart disease patients, surgery recoveries, but under supervision. Make sure to have proper knowledge. Watch my first video and then share this video, both of them, and keep subscribed, keep sharing the video, and give me your reviews, give me your comments. I'll see you next time.